Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
The number of breastfeeding moms has increased to 74.6%. What are the latest recommendations for breastfeeding?
So the American Academy of Pediatrics recommends exclusive breastfeeding for 6 months, so nothing but breast milk, no water, juices, or solid foods. After 6 months, you can start to introduce solid foods, but you want to continue breastfeeding for at least a year. The World Health Organization says the same thing, except for continue breastfeeding for at least 2 years, and then for as long as you want after.
What's the best way to tell if a baby's getting enough milk?
You want to look at the diaper counts. So by day 5, you want to see 6 wet diapers and 3 stool diapers. You want to look at the weight gain. The pediatrician will be tracking the weight of the baby. Is the baby satisfied after coming off the breast? Babies that are full will look nice and relaxed. Their hands will be nice and open. Their face will be nice and relaxed, so kind of look sleepy. You might see some milk dribbling out the corner of their mouth.
What are the benefits to both baby and mom when breastfeeding?
It's good for their immune system. It's good for their GI system. Especially the first milk, the colostrum. It's very thick and sticky, and babies are born with an immature gut. They have little microscopic holes in the lining of their gut, and that colostrum coats the lining of their gut and plugs up those holes so that pathogens can't get in and out.
What foods and drinks should a mother avoid when breastfeeding?
There aren't really any restrictions. Moms can eat and drink whatever they'd like. They can have soft cheeses, deli meat, sushi. All the restrictions that they have during pregnancy are lifted after the baby is born. They can have caffeine as well. We usually recommend no more than 750 milligrams a day.
What is the rule of thumb for nursing a baby after consuming alcohol?
It's less than 1% of the alcohol gets into the mother's milk, so you don't have to worry about pumping or dumping or testing your milk with strips or anything that they sell in the baby stores. You won't harm your baby by having an occasional glass of wine or beer or drink, but it's important not to become too intoxicated and then try to take care of your baby in that state. So normally if you feel fine, if you're sober enough to drive, then you can breastfeed.
Is there an amount of time a mother should wait before breastfeeding?
2 hours is best, but again, so try to time it so that you're drinking 2 hours before the next feeding, but if the baby wakes up a little earlier than expected, it's absolutely fine. You can still feed the baby.
What resources are available for a mother to breastfeed after she leaves the hospital?
So we have a lot of resources in this area. Most of the hospitals who do maternity have some sort of support group set up for breastfeeding mothers. There's baby cafes, which are mother-to-mother support groups, and they're spread out throughout the state. We have one in Worcester. La Leche League is another mother-to-mother support group. Nursing Mothers Council. We're very lucky we live in an area where there are a lot of groups. Parents can also have home visits where they have private practice. Lactation consultants come to their house, and that's usually covered by insurance.
Can all mothers breastfeed?
It depends on how you define breastfeeding. So we've worked with a lot of women who don't make milk but still breastfeed because it's more than just the milk, it's the relationship, and there's other benefits to putting the baby to the breast even if they're not getting that much milk. So in terms of that, yes, every woman can breastfeed. Can every woman make a full milk supply? It's very rare that they can't, but it definitely happens.
What role can a father play when mom is breastfeeding?
It's not recommended for a breastfed baby to have a bottle for the first 3 to 4 weeks, so sometimes dads might feel a little left out because they can't really help with the feeding in terms of actually feeding the baby. But they can do bath time, they can change diapers, they can do skin to skin, they can make sure that mom has enough water when she sits down to nurse or enough food, like one-handed snacks that she can eat, help calm the baby when the baby's upset. So there's lots of other ways for dads to be involved.